Hi, my name is Kim. I'm a nurse here at St. Joseph's Hospital. Either because you've had surgery or because of other urinary complications, your doctor has decided that you should go home with your Foley catheter in place. The purpose of this video today is to help you learn how to take care of your catheter at home and yourself in order to prevent infection and trauma. Some of the things that you should be looking for, specifically in the color of your urine. Your urine normally is a clear yellow in color. Because of some complications or because of surgery, you may notice a blood tinge to your urine, and that's okay. But there are some things that you should look for that you would need to call your doctor for as soon as possible. First of all, if your urine becomes cloudy or develops particles or is foul smelling, that could be a sign of an infection, and it's very important for you to call your doctor. Also, if your urine becomes bloody and it wasn't, or if the bleeding increases, you also need to call your doctor. One thing you should also make note of is if your urine becomes darker, you need to increase your fluid intake. It's very important that you drink at least 8 8-ounce glasses of fluid a day to help keep your bladder flushed and the urine flow clear. Other reasons to call the doctor would be because you developed a fever greater than 101 or if you have shaking chills. Also, if you experience pain with fullness in your abdomen or pain that is not controlled by the medications that the doctor has prescribed for you. Also, if you experience any leakage around the catheter site, or if you notice decreased flow, it's very important for you to call your doctor. First, let me show you some supplies that you will need that we will provide for you to go home with. First of all, hygiene is very important. We will provide for you alcohol prep pads that will be used to cleanse the valves on your drainage bags, and also, even more importantly, the sites where your catheter connects to your drainage bags before and after any bag change. We'll provide for you triple antibiotic ointment that is used after you have cleansed yourself to help promote comfort and prevent infection. In this video, I'm going to show you how to connect from the nighttime drainage bag, which you see now at your bedside, to this leg bag, which will help you promote resuming your daily activities. We'll also send you home with a new nighttime drainage bag to use at home while you are in bed. First, let me talk about hygiene. It's very important before you do anything with your catheter that you wash your hands with soap and water each time. Then, as far as personal hygiene, at least once a day, you should cleanse the area where your catheter goes into your body with soap and water at least once a day, and then pat dry. After that time, you can put the triple antibiotic ointment on to that site, and that helps provide comfort and also helps prevent infection. It's also very important to never pull your catheter for any reason, as that would cause trauma and would cause pain and infection. What I'm going to show you now is how to take care of your catheter so that you do not cause any trauma to yourself and cause any complications. First of all, it's very important to remember with any drainage bag that you're using that you use the leg straps that are provided with the catheter drainage bag. This helps allow slack for the catheter and helps prevent pulling. This is the leg strap that is used with your nighttime drainage bag. It's a Velcro strap that goes around your upper leg and should fit snugly but not too tightly as to not cut off your circulation. But you don't want it to be able to move freely on your leg because that could cause pulling and trauma as well. The attachment is very simple, just with Velcro to fit around your leg. The catheter tube holder is also Velcro and fits snugly around the drainage tube to help keep the catheter in place. The drainage bag should always be kept below the level of the bladder to prevent backflow of urine into the bladder. That could also cause infection. What I'm going to do now is show you how to switch from the night drainage bag to the leg bag that you can use at home to help resume your daily activities. This allows you to be able to walk around and perform light tasks, light exercise. It's very important, again, to use the leg straps that are with your drainage bag. This is attached to the leg bag. There's two for the leg bag, both the top and the bottom. There's buttons on the strap that come up from underneath the drain bag to attach to the drain bag. It's very important when you attach these straps that they are under the drain bag against your skin and not over the drain bag, as this could cut off the flow of urine. When you go to change from the night bag to the leg bag, it's easier if you get your leg bag ready and attached to the opposite leg first. It makes the switch over much easier. So after you've attached the straps to the leg bag, again, these are Velcro. These, again, fit around your upper leg. And they should lie flat with no twists and be wrapped snugly, but not too snugly. The bottom strap should go around the bottom part of your upper leg, not below your knee. And this way to help, again, keep the slack in the catheter. You should have your alcohol prep pads ready to cleanse where the drainage bag attaches to the catheter for both disconnecting and connecting. Now that this leg bag is in place, what you should do is get ready with your index finger and thumb on the catheter and your opposite hand on the drainage bag. Gently disconnect the catheter from the drainage bag. While still holding this in place, remove the cap from the leg bag. It's very important to try to not allow these ports to touch anything. You don't want to risk getting bacteria on them to cause infection. Use your alcohol prep pad to cleanse the port of the drainage bag. And then you can just bring your catheter over to the other drainage bag, rest on the drainage bag, and then you can gently, without pulling on your catheter, attach the catheter to the leg bag. This leg bag under a pair of baggy pants is hard to detect, and this really will allow for comfortable movement around the house and around the outside. When you're finished with the night drainage bag, use a new alcohol prep pad to cleanse where the catheter was attached to the drainage bag. And this also comes with a cap. Replace the cap on the bag. At this point, you can disconnect the bag from the leg strap and disconnect the leg strap from your leg, and put this in a bag for storage. To cleanse the bags, you can use either a syringe or a poultry baster that you've bought specifically for this purpose with soapy water to rinse through the drainage tubes into the bags. Also, at least once a week, you should use a 1-part vinegar to 3-part water solution, and that will help kill any bacteria buildup in the bags. Now I'd like to show you how to empty the bags. Sometimes your doctor may request that you measure your urine output so that we know that your fluid balance is okay. If you need to measure, we'll provide you with a graduated cylinder that has markings to tell you how much urine is in the cylinder, or you can just simply empty them into the toilet. For the leg bag, very simply, this is a screw open valve. All you need to do is open the valve. It does not come off all the way. The urine will drain through this valve into the container into the toilet. After you're done emptying the bag, it is again important to use your alcohol prep pad, a clean one every time, to cleanse the valve. For the nighttime drainage bag, the valve is a little bit different. There's a lever here that you would open. There's arrows here that show you how to open the lever, and the bag simply drains into the container into the toilet. When you close the bag, it's important to hear the click so that you are assured that the bag is closed. And again, use an alcohol prep pad to cleanse the bottom of the valve. It's always important to make sure that the drainage bags are below the level of the bladder. When you're using your lag bag, don't wear it in bed. You should only be using that when you're going to be sitting or standing. If you wear it in bed, it will not be below the level of your bladder, and it could cause backflow of urine into the bladder. If you have any questions about anything that I've showed you today, feel free to ask any nurse that you see, and we'll be able to help you. We'll also be showing you how to do this yourself so that you know exactly how to go about this task. Thank you very much.